My name is Carla Heiser, and I am an advanced practice medical nutritionist. I have a master's degree in nutrition with an emphasis in biochemistry. I've gone through the American Academy of Anti-Aging to confer their diplomat and fellow status, and I'm board certified in anti-aging and regenerative medicine. I am the owner and operator of a nutritional consulting firm, and we are contracted to provide nutrition consultation and education. My team delivers advanced practice nutrition consultations, lifestyle education, menu planning, recipe modification, and culinary training. And we work one-on-one or in small groups. We do demonstrations and tastings, and we work together with patients and their families to create a can-do approach and something that's going to be able to be brought back into their homes and it's going to be doable for them. So I began my career as working in clinical research at the university level, and that created a segue over to working for a national pharmacy where I was in charge of designing and implementing a patient-centered nutrition counseling initiative. The patients that we worked with were afflicted with long-term and chronic disease, which caused them to have to take life-saving medications for the rest of their lives. Given the complicated medication regimens that they followed, one of my first charges was to contact the primary care doctors and to inquire about their receptiveness to making use of nutrient co-therapies. And with their permission and movement forward, I was able to send over research articles, one nutrient at a time, and proof and show the result of a synergistic or a complementary nutrient and medical enhancement, if you would. And we did well. So we created a triad between provider, nutrition, and patient, and we were able to show the proof of concept of the combined approaches without adding more medication onto already complicated routines. So I faxed over research articles one by one, prioritizing things like the effectiveness of probiotics to handle GI side effects, or the role of niacin to help lower cholesterol and other blood fat levels, or the use of fish oil to help with triglycerides and reducing inflammation. In conferring good results, the patients went back to their doctors enthusiastically, and their doctors came back to me to say, what else can we do? I was able to interface more and more with doctors that were prioritizing integrative medicine. And there was a point where we were getting referrals from over 250 physicians, which meant that we had access to a lot of lives. And I recognized that everybody had a different opinion about how to take care of people. So what I sought was advanced practice training. I started taking workshops and evening and weekend sessions, and then realized the scope and breadth of what we were undertaking was more than just a workbook and teach yourself how to get through the myriad of information that was out there. Then I looked for a coordinated curriculum, and that's where I made the decision to go through the board certification training with the A4M. For the patients that we see spans the lifespan, from mothers and fathers that are thinking about making a baby, to infants, childhood through adulthood, and from 70 to 90-year-olds. Our team has different areas of expertise, and we leverage our coordinated and collaborative work together to provide nutritional support and counseling for the patient populations that we serve comprehensively. So there are two major patient profiles that we cater to, and those would be the patients and clients that come through who want to prevent disease and optimize their health, or to patients who are afflicted by medical conditions or concerns, and they're at work trying to reverse or minimize symptoms or handle debilitating side effects of medication regimens. We also offer a comprehensive medically supervised weight management program for children and for adults. We target metabolic reset and work for long-term solutions. Other patient populations and groups that benefit from the work that we do include athletes and women with infertility issues, or men and women who are interested in hormone rebalancing, looking at issues from PMS to menopause to andropause. In our work with athletes, we help them to optimize their strength, endurance, and stamina, food effect, and the ability to replete nutrients, especially for professional athletes or athletes that are participating with long endurance sports. We are able to optimize their physiology to help them to last and to achieve higher outcomes. So in our practice, we are not limited by geography. My medical associates and our clinical team is able to provide support for intervening even with patients that don't live in Illinois. We work from afar and we provide comprehensive medical and intake assessments. We coordinate specialty labs and provide recommendations and reports of findings that they're able to make use of and to get started and get going with their treatment plans. We also interact with and care for our clients with their local treaters as needed.